doing better?
What?
Lower spine?
Yeah.
This is definitely better.
Awesome.
But you're doing your homework every day with the Denneroll?
Yep.
Good.
Twice a day.
Twice a day. It's more than I can ask for. Okay. So we're gonna get in here and do that modified, diversified adjustment we love. Take a nice deep breath in. And let your air all the way, relax this, stretch.
Yes.
Wow. That's perfect. Breathe in. Good. Cool. This one I want to try a different way too. Okay, keep yourself curled down. Good, that's it. And come down. And let your air all the way out and back up. Awesome. Good, sit up straight. And let me check your cervical spine. So lay flat on your back. So good. Take a nice deep breath in. And let your air all the way out. Relax his head down. Good. So down. Perfect. 2, 3, 4. Less. One more time. Got it. Good. Breathe in. And all the way out. Perfect. Good. All right. Face down. Finalize it. Boom, left side. All right, lay down on this side of your body. And this goes here, this goes here. I'm gonna lower you a little bit more. And let you go all the way out, down. Got that one to release nicely. Stand and turn around. We should do the seated, but I want to do the standing thing. Bring your head all the way back with your extension. Your range of motion is definitely gotten a lot better. Okay, perfect. Okay. Turn your head left, this one. Good. Turn your head right now. Good. Back in the middle. Where's it still? Is it still tight or anywhere or not really?
I did a lot of hiking, so I don't know if it's like muscle tight or.
Okay, let's do this. Let's just go do the Denneroll. And if it's still sore after that, we'll do some ice and stim.
Okay.
Okay?